Hello everybody, this is Kenneth Hopland from Medical Care. I'm going to talk to something that's near and dear to my heart, and that is the COVID-19 vaccinations. And I'm going to group the two that are approved right now a little bit into one because even though there are distinguishing marks between the Pfizer and the Moderna vaccination, I'm going to most of the time speak of them as one, and then I'm going to tease apart a little bit of differences for those of you who want to understand the differences between the two. But the reason I'm doing this video is very straightforward, is that I just want to absolutely and completely promote the vaccination. You know, I know that there is a large anti-vaccination movement for lots of reasons, frankly, and some of those are more legitimate than others. I'm going to explain to you why, based on all the things that I've been looking at since these phase 2 trials have been done in June, as to why these vaccinations, in my opinion, are both safe, efficacious, and the way through this pandemic. And frankly, that we don't really have any other option to get through this. So to me, I want to talk about why you need this, and then I want to talk about who needs it, when, and where. And I'll try to be as quick as I can because I know time is always of the essence for everyone. First thing, efficacy. I think everybody knows from watching the news that there's very little discussion about whether or not these two vaccines, Moderna and Pfizer, are efficacious. Both of them reached about 95% efficacy after their second injection. Okay, so those injections means about 5 weeks after the start of the first one, you would reach an immunity of at least 95% is about what we see on these things. That's pretty good. That may be almost as good as vaccinations get. That really means that the breakthrough infection rate once you get the vaccine is very, very low. That's impressive. But what a lot of people don't know is that even after one dose, these vaccines show reduction in disease. So Moderna's vaccination showed about an 80% reduction, and Pfizer showed 55 to 60% reduction in disease even after just 1 week of having the first dose. Now, that's not as impressive as 95%, but it certainly is something for all of us to think about. And that's the reason why the European Union is actually moving some people to use in a single dosage to try to spread this vaccine out. So these are actually very powerful vaccines, and certainly in the way that they're recommended in 2 doses, they work very, very well. The next thing everyone asks me about is safety. In other words, should I get this thing? I don't know if it's safe. I think these were rushed. And my answer to that is that both of these vaccines have undergone extraordinarily large trials. Pfizer was near 40,000 people in their trial, and Moderna was near 30,000. And if you look at the amount of people that got active vaccine in those groups, if you combine them together, it's about 35,000 people. In those trials, there were no unexpected side effects or consequences from receiving the vaccinations other than what we totally expect. All vaccines rev up the immune system, therefore producing some systemic effects such as fevers, body aches, chills, headaches, little kind of flu-like illness. And what that is that's your body's response to a disease. Now, what's going on is not that you have the disease, but your body thinks so. That's why it becomes immune to this, is that it thinks it sees the disease. So you get that response from your body. That's actually appropriate. And about 1 in 3 people get those systemic side effects. But what most people get is, frankly, is a sore arm. So I can tell you that's what I had. My arm hurt for about 3 or 4 days. I'm like, oh, dang. It wasn't unbearable. It wasn't pleasant, but I can tell you it was worth it not to get COVID-19. The next question is, if you say, should I get it? The answer is, who should get it? And the answer is, the older you are, the more you need this vaccine. The sicker you are, the more you need this vaccine. And it's not because this vaccine is going to work better for you. It's because COVID is more dangerous for you. So your trade-off on risk and benefit, your risk is higher, so therefore your benefit is higher, okay? So your risk of the disease is worse, therefore not getting that disease is of greater benefit to individuals who are at higher risk. And that is based primarily on age and other comorbid conditions. So the older you are, the more you need this vaccine, not the opposite. So sometimes when we talk about flu shots and such, we really want to make sure young people get it to try to keep from spreading it. Well, we think that's true for this, but we really want to protect the elderly and the people with diseases like diabetes, heart disease, lung disease, because they're the people who are dying of COVID-19. We want to stop that. It's time to end it, and the way to end it is the vaccinations. The next question is, well, who shouldn't get it? And frankly, there are a couple people who I think I would need to have at least serious thoughts about it. First is pregnant women. It hasn't been tested in pregnant women on purpose. There were a few people in the trials that got pregnant while having the vaccination with no complications. But statistically, we don't know a lot about pregnancy. So I think that those people who are currently pregnant, it's not that you can't get it, but I think I would certainly think twice about it. Those people who are lactating or breastfeeding, I think there's very little evidence it would be harmful, but I'll be honest with you, they haven't tested it in those individuals. It means that if you're going to do that, give it some thought. I think that there are reasons why I would consider doing it, but I can tell you I don't know the answer to that because it's not based on any studies. The other is children. This has not been tested in younger children. It is approved down to age 16. Very few participants between ages 18 and 16. And so I don't think that children have any business with this vaccination at this point. It hasn't been FDA approved for them for good reasons. The other thing is children notoriously do well with COVID-19. So once again, their benefit is less in the first place. So since we have limited vaccinations, I don't think we should be talking about young adults and children getting this vaccine. I think we need to be focused on the older population, the sicker population. And as we get to where those people have already been vaccinated, then we should move down the line. And at that point in time, we'll probably know more about children and whether or not that is appropriate for them. But I think that's coming in the spring, summertime. The other is the myths out there. They're so prolific. I really have a hard time addressing all of them, except to say that some of the myths are downright, they're laughable, for lack of better words. The idea of being plugged into an artificial intelligence, or the idea of being tracked with this vaccine, to me, the answer is the technology to do such a thing doesn't exist in the world that we live in. It really is science fiction. I think it sounds interesting, but it can't be done. I can barely get a cell phone signal with a block that's this big and has a battery. I certainly can't do so with microscopic things that no one can see. And so if you just think about what it would take to do that, it really is a little bit silly. So there is no live virus in this. You cannot get COVID-19 from the vaccination. It does not change your DNA. There is no mutations taking place. This is safe. And frankly, that's playing out in America. We've already given over 5 million doses of this vaccine. We are not seeing anything that's unexpected. There are the allergies discussion. That's another legitimate question. Those people who have severe allergies or anaphylaxis, those people, it's not that they shouldn't get the vaccine, but perhaps they want to get it in an area where someone can watch them afterwards so that if they did have an allergic reaction, there would be someone there to give them their epinephrine. And then at that point in time, you wouldn't recommend a second dose for somebody who had an allergic reaction. The amount of people that has happened to is very small. There's actually very little in these vaccines. It's essentially messenger RNA and what they call nanolipids and some salt water. There's no preservatives. There's no adjunctive things to make the vaccine stronger. So they're very similar in this aspect, and they're actually very clean. When we talk about some of these myths around the COVID-19 vaccination, they are that. They are myths. They're not based in reality. And so, I want to promote to everybody, if you're hearing those things, look into it yourself. Don't just take it at face value. Evaluate what you're hearing, because the obvious answer is we're going to get through this pandemic by either people getting disease or people becoming immune through vaccine. Disease kills people and vaccines don't. And so therefore, I just think the more people we vaccinate, the more lives we save. And I can't think of anything in medicine I want to do more than that. That's the reason for this video. I want you all to get the vaccine if it's at all appropriate for you. So I know there's lots of mindset out there, and all I can ask is that you think about it, Be open-minded, give it consideration. If it's right for you, as soon as it's available, get it. I would recommend it. I've done it. My family's done it. I can't recommend it any more than that. If you have any questions, talk to your doctor. I think that every doctor I know has spent a lot of time thinking about this, so whoever that person is, ask them what they think your risk is and what your benefit might be from the vaccination. So I promote that. It's just as hands down as I can do. Once again, this is Kenneth Hopland from Medical Care. Wish you the best.